Medications, again, serotonin medicines that we talked about already again, these things can help. They take a while to work. Again, it's not like something you take and bam, it's effective the next day and you can walk out and be social and have no problems. This is something that just sort of eases the anxiety slowly as time goes on, and it can help with, especially if it's used with the therapy. Benzodiazepines can help, but they're problematic. And again, with any of these anxiety disorders, they work quickly, and that's sort of the problem. I mean, if I'm trying to teach somebody that going into this place is not dangerous, but yet I'm giving them Xanax because if they go in, I'm afraid they might have an anxiety attack or they might get anxious, that's still sending them the message that it's dangerous, right? That I don't want them to have anxiety because it's dangerous. Well, it's not dangerous. I mean, you got to get through it. So it's uncomfortable, but you got to get through it. I think sometimes the benzodiazepines, they have their place for sure, and certainly are okay to use. A lot of doctors use them, but I think sometimes they interfere with the sort of longer term treatment of these things. Any questions about social phobia? Yeah, absolutely.
Is everyone that has social phobia, I mean, is it all based on fear of embarrassment, or I mean, could it be just fear of being in public or being around people they don't know?
It's a fear. There's different kinds of fear of being in public. It's a good question, by the way. Let me try to repeat it. The question is the fear with social phobia always a fear of being embarrassed or something like that happening, or is it just an anxiety about being around people they don't know? Does that summarize what you said? I would say for the most part, it's a fear of being judged or evaluated negatively in some way. You know, somebody looking at you and saying and thinking something bad of you. You know, Mike went out on me, I guess. But do without it. Is it back? There we go. I've seen all different things though in real life. You know, I've had patients come in and you know, well, you've heard of agoraphobia. Agoraphobia is where you get into a crowded place. Usually it's a crowded place, and getting out is not so easy. So a crowded mall or a crowded store, like we were talking about, you know, something like that, and then you can't, and then you feel like you can't get out. You know, that's agoraphobia. This is more like the social thing. You know, it's like it could be 3 people. It doesn't have to be a big crowded place. It could be, you know, 3 people that you don't know very well, and you're nervous around them. I've had other people that I've seen before come and tell me, you know, it's not so much an anxiety, it's more of an anger situation. Like they go into this place and they see these people and they think, God, what a bunch of stupid people. And it's anger, you know. And, you know, that's got a whole other, that's probably you know, narcissism or some other kind of thing, or anger issues from some other thing, depression, whatever. But social phobia usually is strictly a fear or an anxiety of being in a social situation with people you don't know, and worrying about what they might think of you and that kind of stuff. Does that answer that?
Yeah.
At least best I can, anyway. You know, there's no absolutes with these things. That's the problem.
I know someone that I would associate with social phobia, but I mean, as far as being the fear of embarrassment has never come up or anything of that sort, but they can't handle going out in public even in small crowds.
Oh yeah. You know, and they may not want to talk about it much, you know, because you're right, yeah. I mean, people, well, again, this is sort of the point of my talks, is that hopefully people start to understand these things. They don't think they're so wacko or, you know, whatever, and they can talk about them a little more. But, I mean, it may be that he or she is just as intimidated by you as they might be by other people, and so he or she's afraid of confiding in you that that's what the fear is, you know. Could be that, or it could be that it's something else, you know. And it just presents this way, it looks like this. But, you know, without asking them, I guess you wouldn't know. I don't know if you're close enough to ask them or not. But
yeah, but it's just a really touchy subject.
Yeah. Yeah, and, you know, and the other thing to think about is, and this next type of anxiety we're going to talk about has to do with this,